This is Marcin from MyAirly speaking, and this is the next episode by AirTalks by MyAirly. And today my guest is Oriol Teixidó, an air quality scientist at Environment Agency in Abu Dhabi.
Well, COVID-19 has had an effect on each and every aspect of our daily lives. And this had also an immediate effect on the air quality around the world. For example, movement restrictions and working from home has led to a drastic reduction of the mobility needs of the population, therefore reducing the cars in the street and the pollution emitted by these cars. Also, social distancing and economic slowdown has led to a reduction of industrial activities, leading to a reduction in the emissions from factories and manufacturing activities. What has been extremely interesting from an air quality point of view is that these reductions have been immediately translated to improvements in air quality. The Environment Agency Abu Dhabi has an extensive network of 20 fixed air quality monitoring stations and 2 mobile units, equipped with the best monitoring technology. We have used this data to compare the air quality before and after the preventive measures, and we have seen a drastic reduction in the gas pollutants, especially in nitrogen dioxide, carbon monoxide, and VTEX. And what has been more fascinating is how quick the improvement was in the air quality, showing that our actions have a direct impact on the air we breathe. One example that I think it's very, very interesting is a research study that we have done in air quality station that it's near a main road in Abu Dhabi city center. On March 23rd, the UAE authorities started a daily disinfection program, which was running from 8 p.m. in the evening to 6 a.m. During this disinfection program, the movement of traffic and people was restricted, except for essential services. So that made that after 8 p.m., the traffic dramatically reduced. We analyzed then the Environment Agency minute data observations, and we saw that that led to a drastic improvement of the air quality after 8 p.m. Demonstrating one more time the direct relation between human activities and air quality. Well, this is a very interesting and relevant question. Unfortunately, I'm not the most appropriate person to answer that one. Epidemiologists are doing a great work to understand the relationship between air quality and the spread of COVID. And we should be following the new research being done to understand that relation. At this time, I prefer not to jump to conclusions yet. Even some correlations have been found. To be scientifically correct, we need to give some more time to epidemiologists to prove if there is real causality between the two variables and then think how to use these outcomes. From my point of view, with this crisis, we have learned 2 very important things. First is that human activities have a direct impact on the air we breathe. And second, that when there is an immediate risk or an emergency, the governments act, the people respond, and the private sector adapts. So we have learned that we are a much more resilient society than we thought. With these 2 lessons learned, I think that now we have to move forward accordingly. First, acknowledging the importance of good air quality for our lives. And second, to act at all levels. And by that, I mean for governments to work in collaboration with the private sector, but also to act at the individual level. With each choice that we make, we can help to move towards a more sustainable future with less emissions and more in connection with nature. So now, more than ever, we need to implement economic stimulus to reactivate the economy. So let's use this recovery to move to more sustainable modes of mobility, to produce our energy using renewable technologies, to use more sustainable ways to produce and consume the food we eat, the clothes we wear, and the water we drink. The good news is that the technology solutions are already there. So the only thing that we have to do is to implement them.
Thank you very much for the interview.
Thank you very much, Marcin.